Hello everyone, I'm Dr. Chandrani Datta. I'm based in Mumbai. Today I'm making this video with respect to the death of actor Sidharth Shukla. It is a very sad news and a great tragedy for the family, especially because we lost such a young life at the age of only 40. Uh, so what I would like to talk about is how these diseases, the diseases which are very silent and very chronic, can be prevented, especially in people, in young people. Because I think if you talk to your family doctor or any old doctor uh, who are very respected in their fields, you will understand that a massive cardiac arrest, or commonly called as heart attack, is not common at the age of 40. Uh, to the point that when we hear something like a heart attack at the age of 40, we think that maybe that is not the cause. But the times are such, the days are such that everything is changing. We are seeing very common cases of heart attacks we at an age that we would not expect to. So something must be going wrong, right? Some things must be changing. And since these changes are not in a very positive way, because if you think about it, 40 is not even the middle age, because the life expectancy now has increased. Even though people are getting diagnosed with more chronic diseases, but the life expectancy has increased because treatment modalities are more. So there has to be something that is going wrong, right? Maybe wrong on a multi-dimensional basis. So I'm not saying that what a lifestyle he was leading was wrong, or what happened around him was wrong, because I am not familiar with what he was going through, or the lifestyle that he was leading. I'm not familiar with that. But to hear something like a massive cardiac arrest at the age of only 40 is really, really sad. Because uh, believe it or not, deaths related to your heart, deaths related to your uh, diseases like diabetes, diseases like hypertension, which you commonly call the BP issues, deaths related to your kidney, deaths related to your liver, they are preventable. There are things that you can do at your level which are very much preventable, that will help you prevent these. Now, coming to the point about what I'm going to talk about today, is that heart diseases, they have any number of causes. It can be due to some disease which has not been identified in you yet. It could be because your parents or your grandparents or any of the family members, they might be having some forwarded to you. So these are the kind of things that happens in a silent disease, that you do not know that you have it or not. And by the time the silent disease starts showing you its symptoms, its true colors, it's generally too late, or the medical attention that you might need may not be available to you right away. Like, for example, if undergoing something very serious, and you're in an ambulance, and given the situation in India, it takes a lot of time to reach to the hospital, right? Like it has been said before, for years and decades, that prevention is always better than cure. So at your level, what you can do is prevent major episodes from happening. When I say major episodes, I mean heart attacks, I mean conditions which will put you in very difficult situations, both health wise and money wise. So why not be aware? Awareness is the most important thing. So I want to make you aware, and I really hope that I can help you via this video. So there are a few things that you can do at your level in order to prevent some silent diseases from being, irreversibly harmful to you. Because we all want to live a healthy life, right? Living a healthy life is the most important thing to do, because health is wealth, as we say it. If we don't live, we don't get to enjoy anything, which is the major truth. So if you are a young person, by young I mean below the age of 35 to 40, what you can do is you can get a 6 monthly health checkup done. What I mean by 6 monthly health checkup is that you can get it twice a year. Supposedly, if you're getting it done in January, then again you do it in either in June or in July, then again in December or Jan. So why you should do that, even if you're a perfectly healthy person and what you think you're doing is perfectly healthy, you eat well, you sleep well, your daily schedule is really well, which we all know, to be very frank, is not the fact. But if you think what you're doing is perfectly right and everything is right with you, still these things are not predictable. Okay, like I said, there can be some silent diseases which may run in your family. Like, there could have been some reason why your great grandfather might have died at an early age, but which was never detected, right? So, it could be some disease which was never caught, but it can reappear in you. So, why take the chance, right? You might as well get yourself screened, get yourself checked, you know, and catch it at a very early age. Get a bi-yearly health checkup done, and your health checkup should definitely include the diseases which are silent. So you should get a ECG done. Yes, take a look at your heart, how it is doing. Is it good? Do you have any very mild conditions which may lead to something chronic, or something you need to keep an eye out for, right? Those things, like very minute things, it can be caught on ECG. Yes, not everything, but yeah, maybe very milder ones. And get a complete blood checkup done. See how your hemoglobin is. Make sure that you're not undernutritioned. You should eat well, accordingly. You should take care of yourself. If you're getting very very tired, then yes, it could be a reason that your hemoglobin is low, so that is why you're getting more tired, right? And yes, if you're very tired, you're very anemic, that also puts a lot of pressure on your heart, and of course we don't want it, right? uh, and you should also get your thyroid checked, even if nobody in your family has thyroid issues. Nowadays we are seeing cases where first generation thyroid disorders are detected. So not everything is genetic based, it can even start with you. Okay, so get your thyroid level checked, get your lipid level checked. You might think, I am very young to have cholesterol. I am very, very young. I do eat well. I am a vegetarian. I do not have cholesterol issues, which is very incorrect. Even at a young age of around 25 to 26, I have seen patients with hypercholesterolemia. Why? Father has hypercholesterolemia, grandfather has hypercholesterolemia, patient has hypercholesterolemia. But also people with no familial history, or the history that we are not aware of, has such lifestyles like eating too much junk, which we all tend to do, believe it or not, or accept it or not. We all tend to do this. And cholesterol is such a thing that it will not knock on your door and tell you, ha, you have cholesterol now. Cholesterol is going to be the silent killer. It has been in many cases, in unaccountable number of cases. So get your cholesterol level checked, get your thyroid level checked. Another silent disease which kills people over time is diabetes. And how can you detect your diabetes? By getting your blood sugar level checked. Get your fasting blood sugar checked and your postprandial. Your postprandial blood sugar is 2 hours after eating, right? Get them checked, and if you find that something is abnormal, consult a doctor, right? If you feel that I'm too young to start on medications, it's nothing like that. Everybody will start with lifestyle modification in the beginning, and maybe if things don't change, you might be prescribed some medications, but that is also not the dead end, right? That is because it's treatable. So you're taking medications because you're taking care of yourself. Now, the next thing is, if you're above 40 or you're 40, gift yourself a health checkup, a routine health checkup. Get your ECG done. If your ECG is abnormal, get an echo done. Consult a cardiologist. Do not skip your medications. Chances are that you will have cholesterol issues, because a lot of percentage of Indians, we do have a fatty liver and we have cholesterol issues. Now cholesterol is something that blocks all your arteries, and it stops the blood flow, and that gives you a heart attack, right? So if you're asked to take some cholesterol medications which will prevent cholesterol from increasing, then you must not and never stop them unless it is told by a doctor to stop it, right? Now, the third thing is that you should never do is ignore your symptoms. Symptoms as in, you must be feeling that something is burning in my chest, or only after eating I feel like something coming up my throat. Only after eating, when I lie down, I feel like there is something in my throat. There's some burning in my chest. Now, these are the symptoms which may lead to something chronic, which may be hiding something chronic. Now, this is something, the indigestion, it can be a very vague symptom. It can even be related to your heart. Okay? So, see, something so minor as indigestion can even be related to your heart. Now, another thing, like you have a very, what Indians tend to do is that you have a very chronic cough. You will invent some home remedy, you will find something on YouTube and you will try it on your own, rather than going to a doctor who will be very easily available to you. Because you would prefer having something at home other than going to a doctor. Why do you want to put yourself through that, right? Get a permanent cure, get yourself diagnosed, see if something so minor has a very big background or not, if something so tiny is hiding something big or not, right? So this is a very important behavior modification. This is not a lifestyle modification. This is a behavior modification which you need to have in your life. I'm not saying that a little bit happens and you run to the doctor. No. These are very recurring symptoms which you ignore, and it is not good to do so. Something which is bothering you consistently has a very deep root, and you need to figure that root out, right? The last thing that I want to say is that uh, don't just assume that you're okay, because even vegetarians are deficient of vitamin B12. They need to take your supplements. So don't just assume that you are okay just because you're symptom free. There is a reason why these killer diseases are called as silent diseases, right? Because they will silently do things which after a point becomes non-repairable, right? So it is best to know, like I'm saying, awareness is much better than not knowing anything. Awareness is good, prevention is much better, right? prevention is even better than cure. So eating healthy is definitely number one choice. Number two is, exercising. Yes, definitely, but we all know how much eating healthy and exercising we all do on a daily basis. So exercising is, yes, recommended. Eating healthy is recommended, yes. But let's face the truth. We stay in a place in the world where it is, we all are very surrounded with pollution. We are eating processed food every day, 3 times a day, right? We have even things in us which can cause a lot of toxins. So we have to just assume that our daily routine, our day-to-day life is filled with toxins. So on your personal level, yes, eat healthy, yes, try to stay clean, yes, exercise, by all means do all these things, yes, right, but also get yourselves checked, because none of us know what we are hiding inside health wise. None of us know what is hiding inside of us. And now medicine is so enhanced, so updated, that things are there to help you. We are there for your moral support. We are there to support you throughout. We are there to help you. We are there to prevent these diseases, help you lead a healthy life, help you live a much longer, healthier life, and live a life free of things that could have been prevented. And I would like to give my condolences to the family of Mr. Shukla. It's a really sad event that occurred today, and I hope that this video brings some light onto things that you may have known and have been ignoring, or things that you might have not known and known through this video. I hope you reach out to a doctor. I hope you go to a health clinic and get yourself checked. And I hope that you stay healthy and live a longer life. Thank you.